Brewing today, healthcare platform Curebay has raised $21 million in its Series B funding round that was led by Bertelsmann's India Investments, along with participation from Elevar Equity, along with British International Investment. Launched in 2021 and headquartered in Odisha, Curebay operates 150 plus eClinics around Odisha and Chhattisgarh and says it has served around 5.5 lakh unique patients since its inception. The latest infusion will be deployed to strengthen its in-house proprietary technology stack as well as focus on expansion. On that note, let me invite Priyadarshi M, the founder and CEO of the company, for more on this. Priyadarshi, thanks very much for joining us here on Startup Street. Start by telling us about this $21 million you've raised. Can you confirm if the firm is now valued at $75 million? And importantly, how are you going to deploy the money?
Thank you very much for having me on the show. I'm Priyadarshi. Yes, we've raised 21 million of aligned capital, and it's very, very strongly going to fuel our growth in terms of expansion into new geographies, which is Bihar and Jharkhand that we're immediately looking at. We're also going to continue investing in tech platform. Tech has been our leverage. We have used tech to create an access to high quality and affordable healthcare in remote, medically underserved rural locations, and we'll continue investing on our tech platform. And this is a journey, this is a purpose in which we are looking at high quality talent to come and join hands with us. So that's the third area which we are going to use and deploy our funds in.
Priyadarshi, thanks very much for correcting us, of course. But, so far you have about 150 clinics across Odisha and Chhattisgarh. What is the next logical expansion plan in terms of states? And how many new clinics are you targeting to open there?
So we have observed that in healthcare, there is a movement across the border. There is an adjacency movement, both in terms of patient as well as healthcare services. So now that we are present in Odisha and Chhattisgarh, we are looking at moving to Jharkhand, southern Jharkhand specifically, as the next area of movement. From southern Jharkhand, we will move into central Jharkhand and then Bihar. We're going to add about 150 more clinics in the next 12 to 18 months.
All right, so that'll take the total to about 300. In terms of your financials as well, your operating income of about 10.3 crores and losses of 39 crores in FY24. Since then, you have announced that Balasore and Puri circles have achieved operational profitability for you. But what about overall profitability? And if you could give us any sense of how FY25 has shaped up?
We are creating a model where we are creating a concept called Circle. Circle is a cluster of clinics. It's about 50 clinics because we have to build the infrastructure to support these 50 clinics in terms of the foundational investment into logistics network, into healthcare ecosystem that we do. So currently we are operating in 3 circles, out of which 2 of them have achieved operational break-even and the third one is on track. Overall, at the company level, we are continuing to invest in areas like technology, continuing to invest in areas like the healthcare data platform, where we will still be burning money. But yes, at an operation level, we are looking at achieving operational break-even at a company level.
Okay, operational profitability and then perhaps profit after taxes. But, I read that you say that your preventive healthcare program, that has 90,000 active members at the moment and a renewal rate of more than 60%. At what rate is this really expected to grow with your 300 clinics, with the 150 more that you're planning and the expansion plans you have in other states?
So interestingly, in rural India, unlike urban, people don't seek healthcare very proactively. They actually sort of come to you when the condition is either acute or chronic. Our objective was to ensure that if we're bringing high quality healthcare, we should be able to move them on a preventive journey. So we created a membership program by which, paying us amount like 399 rupees for a year, they get unlimited doctor consultation and certain amount of diagnostic tests free of cost, and most of the other services at a discounted play, which has helped them move on this preventive journey. Yes, you're right. Currently, we're very close to 100,000 people on this membership. And as we are expanding our clinics from the current acquisition of close to 10,000 members a month, we look at sort of tripling this number as we go forward.
And, these people that you're enrolling in your program, is there some sort of health insurance coverage as well that you're, tying up with players for or looking to get or have own plans of entering?
So we have an insurance partner who partners with us if there are patients in the program who have availed of a program when they go for tertiary requirements for the loss of income and travel expenses that they have, they're covered for 1,000 rupees a day as hospicash. And we have a strong insurance partnership there.
All right. Just quickly to step back and give us a bigger picture of the kind of challenges you see when you talk about implementing these technology-driven healthcare solutions for, the rural Indian customers. With the kind of database also that you're building, what sort of monetization strategies also would you have?
So tech has been the strongest leverage for us because we realize if you have to solve for healthcare, you can't physically ensure that there's a doctor available in the remotest area. So we had to create a model where there's a human touch in the front end, as well as technology is leveraging to bring the right healthcare service providers to the remotest area. And that's where we have not just used technology, we have used smart technology. So we are able to capture healthcare data into the market that we go. We are able to do homogeneous cohort analysis, and that sort of helps us fine-tune the healthcare interventions that we want to do in these markets, because primary healthcare is a very broad canvas. So unless you stay focused on what you're going to drive, it'll be very difficult to responsibly grow in a profitable manner. So technology has been the cornerstone in driving that initiative for us.
And we wish you the best with it, Priyadarshi. Thank you very much for your time here on Startup Street today. It was a pleasure speaking with you.
Absolutely my pleasure. Thank you.